The commonest symptoms are pain, especially on passing stools. Patients feel like they're sitting on a piece of glass when they pass stools. It can be associated with a bit of bleeding from the bottom as well, but the main symptom tends to be pain during defecation. Usually, the best way to diagnose it is by clinical examination. The surgeon can see a cut in the lining of the back passage. It's usually in the midline, usually towards the back of the midline, and it's best assessed and examined visually by a surgeon. So we start by conservative measures, which is usually topical creams, which are muscle relaxing creams. They tend to relax the muscles because the muscles tend to go into spasm with the fissure, and that reduces the blood flow to the fissure, which it doesn't allow it to heal properly. So the aim of the cream is to relax the muscles, to allow blood to flow to the fissure, to allow it to heal properly. Patients tend to be constipated a little bit as a result of the spasms, so we give them laxatives, we give them painkillers, we give them appropriate dietary advice so that they're not constipated, and that usually helps in healing of the fissures as first-line treatment. Now, if patients don't respond to these topical creams, then the next line is usually to inject Botox into the internal sphincter muscle. This is the muscle that tends to go into spasm. And to relax that muscle, we inject Botox into it, which then which relaxes the sphincter muscle, allows blood to flow to the fissure, which allows it to heal, and the relief of the spasm takes away the pain as well. And usually that's all that is required. There are other surgical procedures which are used not very commonly these days. The majority of patients will respond to either conservative measures with topical creams or to a Botox injection. They can. The smaller fissures, the superficial fissures, can sometimes heal as long as patients are not straining during defecation. But the deeper ones or the chronic ones or the larger ones quite often need a bit of medical intervention in the form of topical creams. The commonest cause for fissures is straining during defecation, during passing stools. So simple things like ensuring there's plenty of fiber in the diet on a daily basis, drinking plenty of fluids on a regular basis, and just ensuring that you're not straining in the toilet when will make a huge difference in preventing these fissures from forming. And if that means taking more fiber supplements, taking the odd laxative now and then, that'll help. Other important things are only going to the toilet when you need to, only sitting for as long as you need to. So avoid taking a mobile phone or a magazine or a newspaper with you and sitting on the toilet as your sort of private space and your relaxation space doesn't actually work because it can precipitate these fissures along with other anorectal problems. So these little things will help.